COVID-19, tips for prevention and personal protection. Learning objectives. Understand the symptoms and methods of transmission of coronavirus 2019, also known as COVID-19. Understand the steps that can be taken to prevent infection of the virus. Understand the importance of proper disinfection techniques and face coverings. Become familiar with your leave benefits in regards to COVID-19. Tips for prevention and personal protection. Know how it spreads. There is currently no vaccine to prevent coronavirus disease 2019, also known as COVID-19. The best way to prevent illness is to avoid being exposed to the virus. How does it spread? The virus is thought to spread mainly from person to person, between people who are in close contact with one another within about 6 feet, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. What are the symptoms? People with COVID-19 have a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Shortness of breath, difficulty breathing, fever or chills, cough, fatigue, muscle or body ache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea, headache. Who is at the highest risk? Based on what we know now, those at high risk for severe illness from COVID-19 are 65 years and older, or those living in a nursing home or long-term care facility. People of all ages with underlying medical conditions, particularly if not well controlled, including chronic lung disease or moderate to severe asthma, serious heart conditions, severe obesity, having a BMI of over 40 or higher, diabetes, chronic kidney disease undergoing dialysis, and liver disease. People who are immunocompromised are also at great risk. Many conditions can cause a person to become immunocompromised, including cancer treatment, smoking, bone marrow, or organ transplantation, immune deficiencies, poorly controlled HIV or AIDS, and prolonged use of corticosteroids and other immune weakening medications. What can we do to prevent infection? Wash your hands, often, with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hand and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick, even inside your home. If possible, maintain 6 feet between the person who is sick and other household members. Put distance between yourself and other people outside of your home. Remember that some people without symptoms may be able to spread the virus. Stay at least 6 feet, about 2 arms length, from other people. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Cover your mouth and nose with a face covering when around others. You could spread COVID-19 to others, even if you do not feel sick. Everyone should wear a cloth face cover when they have to go out in public. For example, to the grocery store or to pick up other necessities. However, cloth face coverings should not be placed on young children under age 2, anyone who has trouble breathing, or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. The cloth face cover is meant to protect others in case you are infected. The cloth face cover is not a substitute for social distancing. Maintain about 6 feet between yourself and others. If you are around others and do not have on your cloth face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow, and do not spit. Throw used tissues into the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Then, use a district-approved sanitizer. Contact your site's custodian to receive a bottle of the district's approved solution. It works effectively and is compliant with the California State Healthy Schools Act. Be alert for symptoms such as fever, cough, shortness of breath, or other symptoms of COVID-19. Take your temperature if symptoms develop, but not within 30 minutes of exercising or after taking medications that could lower your temperature, like acetaminophen. Follow CDC guidance if symptoms develop. Do not come to work if you are feeling ill or experiencing the aforementioned symptoms. Cleaning at our sites. As with past viral outbreaks, the EGUSD Custodial Department has adapted its protocols to include cleaning for health. This includes expanded cleaning on touch points and communal areas. A recent addition to custodial cleaning efforts is the use of aqueous ozone to clean and sanitize our sites. Aqueous ozone is an effective cleaning agent that leaves no chemical residue. Please see how it works in the steps outlined on the next slide. How stabilized aqueous ozone cleans and sanitizes. Stabilized aqueous ozone is created when introducing an extra oxygen atom to an oxygen molecule and water molecules. This combination creates a highly effective cleaning agent that breaks down dirt, grease, and other contaminants in the same way as toxic cleaners, but naturally. The process can be shown in 4 simple steps. Step 1. Oxygen from the air is safely turned into ozone and then infused into ordinary tap water. Step 2. The ozone is attracted to germs, soils, and bacteria. Step 3. Ozone quickly attacks and eliminates contaminants it comes in contact with. Step 4. Only pure oxygen and water remain after the ozone cleans and sanitizes. COVID-19 related leave benefits. You can find more information on paid leave benefits that you may be entitled to receive that would make it financially easier to stay at home when sick. See additional information on government programs supporting sick leave and workers' compensation for COVID-19, including workers' sick leave rights under the Families First Coronavirus Response Act and workers' rights to workers' compensation benefits by visiting the Department of Labor's website at www.dol.gov. In conclusion, while there is no cure or vaccine for COVID-19, following these simple precautions will reduce your risk of infection or transmission of the virus.